Hello again, welcome back to my YouTube video channel. I'm going to continue present to you some of the reason why why you need braces. So I'm going to share the screen so we can go ahead and start this one. Give me 1 second. Hello everyone, welcome back to my YouTube video channel. I am today going to present with you some of the reason why you should consider braces. So my name is Dr. Lockwin, and I'm going to explain to you what the reason why you need braces and what are those, okay? So I did some quick research, and here is from what I see on the literature as well as what I've been practicing in the past 2 decades, patients who have complicated with their dentition that could have been reduced or prevent from TMJ, pain, grinding, bruxism, wearing your enamel, teeth loss, gum disease, lack of confidence, emotional unstable, poor digestive system, risks of cardiovascular disease such as heart attack, stroke, and diabetes, and social status concern. And so what are the main negative consequence of the malocclusion, that what we call, or the basically the crooked teeth, is the uneven distribution of the load on your teeth. And normally it would take on a very balanced bite, but now because your bite is off, so it takes a lot of tremendous amount of force to a certain area of your mouth, and that's where you have pain and you have broken restoration, and you have caries, easy to break your teeth. You have periodontal disease, gum bleeding, your tooth mobile, and you have TMJ pain. You have clicking jaw or joint pain on your TMJ, your joint here, and sometimes you have a jamming. You can't open your mouth, and those are complications, and it's result into very not very pleasant looking smile. So I'm going to show you some of the picture that the ideal smile, how it look like. And before we go that, I want to let you know that there's several kind of malocclusion, or basically unideal smile. That would be a distal bite, mesal bite, deep bite, open bite, cross bite. I'm going to go ahead and show you some of the case, then you understand more. So here is the ideal smile. As you can see, patient have perfect smile on her smile. These are the case that we finished. And ideally, you can see that the teeth on the top and the bottom is aligned. Ideally, to partner on top with another on the bottom. Those are ideal smile. And you're going to see that why I'll tell you why those, when you have this type of ideal smile, you will be minimizing trouble for your future problem. So this is the patient that we correct them. And these are the teeth I'm talking about: bottom teeth straight, lower teeth, top teeth straight. This is another case. With this case, patients started with a lot of trouble, but we get to this point to stabilize their mouth. Smile look beautiful, but this is what I'm talking about right here. So imagine if you have the teeth that like this. This is a consequence of, when the patient was young, not able to have a chance to have braces, and now the force that distribute on the front teeth were tremendous, and it's wear out his teeth completely on the front teeth. You see on the front teeth, it could have been improved by braces, move the upper teeth out and the lower teeth back a little bit, and would be reduce the risk of this problem. But now you can see it's terrible. So here's another one on the left side, same thing. This is how the patient's smile could have been improved way before it get to this point, wearing so much enamel. Here's another picture. You can see that look like with the normal eyes of a patient, you would say this is not too bad, but you can see that you see a female, and she can see how wearing their front teeth out simply because of the overbite and the deep bite of the patient. So if you look closely, you see on the bottom teeth, they have enamel chip breaking, and the upper teeth enamel sharp teeth here. That's simply because of the discrepancy of her bite on the front teeth. Here is another case. Patient have a pretty nice looking lady, but as you can see, her front teeth and the bottom teeth have an evidence of chip enamel wear and tear. And that's because of the super erupted on the bottom tooth here, and also the super eruptive of the two front teeth. So those are the situations that could have been improved if the patient have done their consultation early and get a treatment. This is another case, and when the patient have not a perfect teeth, you can see gum recession starting top and bottom because the bite is not right. All right. So in the gum bleeding, you see, that's because of there's so much space between the teeth, foot trap easily, heavy occlusion on the front teeth. Here's another nice, handsome looking guy, but you can see that the enamel wearing out. I'm gonna go back. So this is his upper teeth, just minor crowded. And on the bottom, just minor crowded, but you can see on the front teeth, the enamel wearing out because of the malocclusion, the edge-to-edge bite. So this is the basis information for dentists, general dentists, as well as for patients who want to figure out whether they need braces or not. If you have this type of teeth, you need braces. Okay, look at this another case here. As you can see that patients have lower teeth uneven, and that's a consequence of plaque buildup right here and bleeding gum. And this is tremendously affect his oral hygiene. And same thing with the gum on the top, bleeding gum due to bite that is improper bite. So enamel chip right here and an enamel evidence of wear and tear. So when you have teeth like this, you need braces. All right, another case, you see patient have really so many teeth, not enough room, evidence of gum recession right here, and evidence of teeth enamel on the front here, wear and tear. So you can see right there, that's the enamel wearing of the teeth. Patient is not that old, but you can see that the evidence of wear and tear. So here's another same picture that I showed last time, but you can see on this right side, crooked, crowded teeth result into enamel wear and tear, chip and plaque buildup and causing gum disease. Same problem there, same problem there. You see? Here's another case. Patient could have been improved with his tooth loss due to enamel tooth fracture decay, as well as malocclusion with the bite is off. Now he got this tooth is number 9, basically hit right on top of the bottom teeth. So it could have been corrected with braces at the beginning, but he waited so long, didn't have chance to see a dentist. Now all the back teeth is lost, and the front teeth now had to support his dentition, and then there are a lot of force of biting and chewing, and that's what happened to front teeth here. So yep, when you don't have straight teeth, when you lose back teeth, your balance of your malocclusion is completely off, and that's why it throw up your balance of your bite, your joint, and it's become a problem. Very important to keep your as many teeth as possible to maintain as long as your dentition. Here is another picture of the patient that have to end up with upper complete denture and some implant on top. But the bottom teeth, you can see the evidence of enamel wear and tear because of the lack of proper bite. So those are consequent. Now this tooth, same thing, slightly crooked, but as you can see that there's a lot of plaque buildup and bleeding gum due to, and also you can see that enamel fracture and worn out on the back teeth here due to an imbalanced bite of the patient. The patient didn't have a proper bite. Even though you can see not a lot of cavity involved, but you can see teeth wearing out because of the bite is incorrectly. Another case, patient have restoration everywhere, but as you can see that with slightly not perfect bite, slightly over bite can create enamel chip or front teeth here. So this is not an extreme case, but I can just want to show you that enamel wear and tear usually due to the lack of balance occlusion, balance bite. Patient have a minor teeth crooked, but you can see enamel wear and tear on the lower teeth and upper teeth. So this is the, you look at his smile right here, you will say, oh, it's not too bad, right? But you can see that if he opened his mouth, enamel wear and tear due to an imbalanced bite. These patients need braces to keep their teeth longer. Now, this is another severe case. Patient didn't have a good bite. You can see the smile here. The deep bite result into enamel crack, fracture, chip, broken, everything. Enamel wear and tear on the incisor on the front, lower front teeth as the result of the deep bite. So yes, patient need braces. Same thing. This is another case, a young lady, but look at that. 26 years old with enamel wear and tear on top and bottom due to just a minor crowded on the top and moderate crowded on the lower would result into very crooked teeth. If you don't have the skill of diagnosing braces, you can simply ignore it. But when you have some training with orthodontist training, you see that this is a good opportunity to help the patient to improve their confidence level and as well as the longevity of their teeth. Here's another teeth. You can see that look pretty good, right? But if you can, the patient open up, there is enamel wear and tear on number 8, 7, 8, 9, 10, more prominently on the number 8 and 9. That's because of the edge to edge bite right there. And forcefully causing this flare of the space between number 9 and 10 here at the result of improper bite. These cases require not just veneer, but get braces first, correct the bite, you guys. Here's another case, as you can see, enamel wear and tear, chip on top and bottom. Those are adult case, need braces. Once we correct this, we smooth everything out, the teeth will last for life. We don't do anything, in the next 5-10 years, these teeth will wear out significantly and result into fracture and broken teeth. All right, so as you can see, same patient, I just wanted to show you, even though her teeth look nice and straight, but the way she bite and smile improper, and with the lower crowded teeth, this would result in significant enamel wear and tear on 23 to 26 right there. Here is another picture of a nice looking gentleman, young one. When you look at a picture like this, look fine, right? You look closely, you got enamel wear and tear of number 24 and 25 right there. Why? Because the patient have a deep bite. So as you can see, not align on the proper, all the upper art is completely not balanced. Same, even though the bottom tip are pretty nice art, but that result in the wear and tear of the incisor. And you can see it causing a lot of enamel defect, even on the lingual side of this number 25. That's where we're at on number 8 and 9. Very important to diagnose and identify the early problem for the patient. Here is what I'm talking about. If we ignore the patient with their bite, and this is the result from malocclusion, improper bite, the patient now have really severely enamel missing on the facial aspect, lower incisor. Look at that, improper bite. These two four teeth hit each other badly, causing the bend of the enamel. All right, here's the next one. So improper alignment of your teeth. If you have root canal, it will fail. It will break because the bite is off. You see the evidence of the wear and tear of the lower incisor. Whatever you put here, it's going to break. Up here, it's going to break if you don't correct the occlusion. So unfortunately, many patients go to a dentist, but never want to get braces. And now that's the result. All right, this is a young 14 years old boy came into the office with this teeth here. Take a look. He's so young, but he only have enamel wear and tear due to the improper bite. So doesn't matter how young you are, your enamel can start become wear out at you don't have a proper bite right there. You see the evidence of wearing of the enamel on the lower teeth? That is because of the crooked teeth. So here's another picture of the case where you can see that the neglecting of the treatment of dental care causing the severe gum disease and the lack of confidence on the patient with tremendous plaque buildup in the upper here due to a lot of space here. When you have imbalanced bite, like you have space of your mouth, you need braces too, otherwise plaque buildup, and this is a consequence of the bad management of the patient that doesn't want to get comprehensive treatment with braces and correct with cosmetic dentistry. All right, so the last photo here, patient looks fairly nice, but as you can see, uneven smile due to number 8 and 9 chip and break. That's due to the result of a deep bite and super erupted on the lower teeth here. You can see that those teeth are coming up very high. So this results into, if you look carefully on number 8 and 9, there is enamel wearing and tearing. Same thing on the lower right there. So even it's a minor problem, it can result in the severe problem for the patient in long run. So I want to stop right now and just summarize for you guys that when you have a good smile, when you have a perfect bite, you have chance that you have perfect teeth for life is pretty high. When you have crooked teeth, when you have a minor problem, your chance that you will lose 1 or 2 teeth for the rest of your life is pretty high. And the consequence of severe mouth occlusion, severe dental problem, crooked teeth without correcting is resulting to lack of confidence due to loss of teeth, due to gum disease, due to temporomandibular joint disorder, jaw pain, and many other problems, such as consequence of undigested food result into diabetes, diabetes result into a complication of heart attack and stroke. Those are bad consequences. I hope that you guys receive this message and get yourself a chance to see your dentist and see your orthodontist. Thank you for watching. Have a great day. If you like this video, guys, don't forget to subscribe and click the below button down here and make some comment. I'd like to see you next video. Have a great day. Bye-bye.